Hello, today we will be discussing on how to position for an AP Humerus. Let's begin. First, we will need to do our patient preparation. We will need to introduce ourselves and to inform the patient that we will be taking their images. We will need to ask the patient for their full name, date of birth, and last menstrual period if needed. Our image receptor size should be about 14 by 17 or a 10 by 12 cassette. The cassette should be long enough to cover the entire humerus, depending on if the patient is an adult or a pediatric patient. Our image receptor orientation should be set to portrait, and our image receptor location will either be our table bookie or our wall bookie, depending on how the patient will be set up, either standing up or laying down. Our SID will be set at 40 inches. This will be due to either being at the table bookie or at the wall bookie. Our patient positioning. Our patient positioning is either going to be erect or supine or standing up or laying down. We will need to adjust the height of the cassette so that the shoulder and elbow joints are both parallel to the image receptor. This will allow us to be able to get a very good image out of our x-ray. Our part position. We will need to rotate the affected arm as needed to be able to bring the shoulder and proximal humerus into contact with the cassette. We will also need to align the humerus with long axis to the image receptor, and inform our patient that we need to extend the hand and forearm as far as they possibly can. Our epicondyles of the elbow should be parallel and equidistant to the image receptor. Our central ray location will be at the midpoint of the humerus and perpendicular to the image receptor. For this image, we will actually do not need any kind of angulation. Our collimation field size. The collimation for this image will be about 1 inch outside of the soft tissue. This must also include the shoulder joint and elbow joint, approximately 1 inch past both. The visual and appropriate marker location. The location for our markers should be anywhere in the collimation field, so long as it does not obscure the image, usually on the lateral side of the forearm. Our KVP range for our real patients. Our KVP for this image should be about 70 to 75 KVP, although 75 kp will be our most ideal for our real patients. Our instructions to the patient for the exposure. We will need to inform the patient that they will need to hold as still as possible and not move. We will also inform them that we will be doing suspended respiration during our exposure. We will have our patient take a deep breath in and let all the air out, and hold while we do the exposure, and then to breathe in normally as usual. The anatomy demonstrated in this image should be an AP projection, which shows the entire humerus. It should also include the shoulder and elbow joints. Items in profile. Our items in profile in this image should be the entire humerus, the greater tubercle and humeral head, as well as our medial and lateral epicondyles. Our pathology best demonstrated for this image will usually be fractures or dislocation of the humerus, as well as a pathological process including osteoporosis. This concludes our time on how to set up for an AP humerus. Thank you.